We are now having 40+ thousand new cases a day. I would not be surprised if we go up to 100,000 a day if this does not turn around, and so I am very concerned.
That Dr. Anthony Fauci with an alarming projection as he joined other leading health experts on Capitol Hill today, warning about the spread of COVID-19. Fauci and the head of the CDC also saying if people don't do the right thing, and I mean right now, like wearing masks and socially distancing, we will be in even worse shape than we are as we speak. Tom Bossert, a former Homeland Security official in the Trump administration, he made this alarming projection.
We just don't know what people are going to do. And so if we don't change the behaviors that we're covering and seeing, we could see a death toll of 500,000, not the 120,000 where we are today.
Think about that number. Well, this all comes as we're seeing the numbers heading in, unfortunately, too often the wrong direction. Instead of bending the curve like European countries managed to do, the trend lines here in the States are heading straight up. In the past week, Florida has seen nearly 50,000 new cases, that leading the nation. California and Texas have each had more than 30,000 in the past 7 days, and Arizona not far behind. Now, all of those states, they're rolling back the reopening plans. In LA County, it's closing its beaches so they won't be open for the July 4th weekend. Several other areas restricting operations at bars and restaurants and also limiting gatherings. Here, the governor and mayor of LA.
In the last 7 days, we've seen a 45% increase in the total number of cases that have tested positive in the state of California.
We've kind of begun to assume that everybody around us isn't infectious. COVID-19 is taking control, and we need to take control back. So to young people, you are not immune.
And the mayor goes on to say the next 2 weeks will tell the story if they can. That's the only time frame they have to take control back from COVID. To Arizona next, the state delaying the reopening of schools, and the governor, he's ordered gyms, bars, movie theaters, and more to shutter. Plus, hospitals in many parts of Arizona, they're filled up almost to capacity, scrambling to activate surge plans to deal with the flood of patients. This doctor in a Tucson explaining what they're dealing with.
Never have I seen this many patients in our ICU. I mean, we're using ICUs that we've never used before. Patients are suffering. They're on ventilators for weeks. Families cannot be here. There are patients begging me not to put them on the breathing machine because they know that they might die and might never talk to their families again.
And now states in the Northeast that peaked in March and April, they are taking new precautions. New Jersey, they're delaying the reopening of indoor dining in restaurants. It was supposed to reopen later this week. And New Jersey, as well as New York and Connecticut, they've all banded together to require people traveling there from many states now to quarantine for 14 days. Originally, it was only about a half a dozen states, but now it has been greatly expanded because of the outbreak spread. As you can see, Texas, it is also on that map. And now that state, it's also rolling back its reopening plans. Governor Greg Abbott announcing that all bars are now required to close and restaurants have to scale back to 50% capacity. And as you've heard, Houston, it's been particularly hard hit. CNN got special access to a hospital there, and it spoke with frontline workers who are dealing with the surge in patients.
In the last 3 weeks, I have seen more admissions and sicker patients than on the previous 10 weeks. So it's been an exponential increase on the severity of illness and on the number of cases that we admit.
Now, before I bring in my guest, I wanted to play something that the head of the National School of Tropical Medicine at Baylor, what he said about the virus and about the potential spread, and specifically about the state of Texas.
Our big metro areas seem to be rising very quickly, and some of the models are, on the verge of being apocalyptic.
Apocalyptic. Let's bring in our guest, Dr. Pritesh Gandhi. He's a physician at a community health center in Austin. He's also running for Congress. Doctor, that was last week. We heard this morning what Dr. Fauci had to say, testifying before Congress and others. They paint a very frightening situation, potentially, that you guys could be looking at in the next couple of weeks and even more nationally. How concerned are you just how bad this thing could get?
Deeply. Look, I'm not going to come here and paint a rosy picture for anybody. We are concerned, and I think what gets lost in this conversation often is what is happening on the ground, right? Because all of us are becoming increasingly numb to the metrics. We have had multiple days in a row of record hospitalizations and ICU utilization in the Austin area. We know ICUs are near capacity in Houston, but I think again we're all numb to this. In clinic yesterday, we saw almost 3 or 4 times as many patients with coronavirus symptoms and for swabbing than we did in the weeks prior. And so, in real time on the ground, we are taxing not just hospitals, but community health centers, outpatient centers. And I'm worried. I'm worried about the effect on our healthcare workforce. I'm worried about our ability to scale. I'm worried about our ability to contact trace. This is real.
You know, from the perspective, a lot of our audience went through this in the New York, New Jersey, broader metropolitan area, as well as other certain spots hit almost as hard on the eastern seaboard. In some ways, I would be more frustrated if I was in Texas in your shoes right now, or in other parts that saw, you know, the preview of what could happen. But at least in New York, there was unanimity from the mayor and the governor and from other officials that dramatic action and not minimizing, or maybe here we'll do one thing, here we'll do something else. At least there was a coherent plan to shut everything down. Still right now in Texas, how frustrating is it? Just 2 weeks ago, the governor said he wasn't that worried because they had more than enough beds and the hospitals could handle this. Now, there still isn't a mandate to even put masks on. You got July 4th weekend right around the corner. Are you concerned, but are you also angry?
Angry doesn't quite capture the complexity of the emotions that healthcare professionals and experts in the field are feeling. The governor has abdicated his duty to protect the well-being and health of Texans. Those that have politicized the response to this pandemic have abdicated their responsibility to the community. The reality is that there are tried and true public health measures that should have been implemented sooner, that should have been rigorously scaled, and should have been supported publicly, that just hasn't happened at the state level, and certainly not at the federal level. So we're seeing failure across the political spectrum here in Texas. And what I mean by that is that the GOP leadership at the state level, at the city levels, have decided to not move forward with basic common sense things like mandatory masks. I mean, this isn't rocket science here. We're talking about wearing a mask outside, a low-cost intervention that can save lives. We're talking about putting pop-up testing centers in affected neighborhoods because that can save lives. Basics. And yet, those that fight for these basic measures are eviscerated in the public space. And I'm honestly sick and tired of seeing my colleagues in public health bullied out of their roles, bullied out of their positions, because they are standing on the side of science, and the people and politicians are taking advantage of this moment to peddle theories and treatments that don't work. And it's disgusting and it's frustrating. And yes, I'm angry, but more than anything, I'm worried about the well-being of our communities that we're seeking to serve.
You know, some of the statements, I'd like you to debunk this idea that, yeah, maybe there's a lot of positive tests, but a lot of younger people, so the mortality rate's low. Basically, it'll stay that way. Talk about, obviously, we've seen asymptomatic people spreading this right now in big numbers here. And yes, thank God, the mortality rate so far for younger people is very low. We know how fast this thing can spread to wildfire, to people with the underlying conditions, let alone the elderly. Talk about this misrepresentation of the real stage right now of what people say it's an inevitability in 2 weeks, just how bad it's going to be for you guys.
Yeah, I mean, I think that there's this absolute false sense of safety that people have, thinking that, well, if the young kids have it, it's fine, they'll recover, no big deal. Let's look at the facts, right? We've had a almost 400% increase in the number of positive cases since phase 1 reopening. We've had a doubling of the percent positive statewide from what was roughly 5-ish% just a couple of months ago to now what is roughly 11 or 12%. And then of course, as we've talked about, an increase in hospitalizations. And so that's an important metric here, right? We're seeing more positives, more cases, but more morbidity. People are ill in the hospital. And I think that for folks that feel that, well, okay, if you're young, you have the system to get over it. This is a novel virus, which means that there's a heck of a lot about it that we just don't know yet. I don't know what the long-term effect is on the lung capacity of a 22-year-old who has a particularly severe form of the virus, what effect that's going to have 10 years down the line or 20 years down the line. And so I think there is worry there that there is quite a bit more to learn about the virus. And then on the other hand, we are in a critical period in Houston, Austin, Dallas, San Antonio on how we manage this. Young folks are vectors for illness in our community. We know that the risk really is with their parents and their grandparents, and this will spread quickly if we don't put in common sense measures to limit the kind of social gatherings that we're seeing happening all across the state.
And the most frustrating part is this was all avoidable. Doctor, wish you the best of luck here. You got some trying times ahead of you, but I appreciate you making time for us today.
Happy to be here. Thanks for having me.
All right, everyone. When we come back, we're going to take another portion of this issue, which has been somehow a battle over information with science and medicine seemingly about fact. There's so much, though, that hasn't been about fact. Misinformation. And one of the biggest culprits of it, Fox News. They've been downplaying COVID for months and also spouting some dangerous falsehoods about the virus. Now, we're seeing the very real consequences of that. After the break, we're going to show you what we mean.